Hello, welcome to the National Hispanic Medical Association conference today on transgender Latinas and HIV. We have a special agenda set up, and this is a partnership with the Centers for Disease Control and Prevention, and we're very happy to have with us Bamby Salcedo, the President and CEO of TransLatin Coalition, and Luis Freddy Molano. Dr. Molano is Vice President of Infectious Diseases and LGBTQ Programs and Services at the Community Healthcare Network. Oh, I see. The slides here we have from the Centers for Disease Control and Prevention. We just wanted to call everybody's attention to the great resources that are on the CDC pages. These are especially for providers, educational information and campaign materials for your social media on HIV screening, on PrEP and PEP, on HIV and prevention for persons with HIV, and also for prevention and care for transgender people. The HIV Nexus is the new hub and with online CDC resources for clinicians. Serves as a one-stop hub for resources designed to support all types of clinicians and includes the latest research and information on HIV prevention, screening, and treatment, access to free continuing medical education programs, CME programs, has CDC guidelines and recommendations, and patient education materials. NHMA is proud to be a partner with HIV Nexus and the End HIV epidemic that is so important in our communities, especially Latino communities and Latinas specifically, and in this case, transgender Latinas. Ben?
Thank you, Dr. Rios. First, we'll start to hear from Bamby Salcedo. And Bamby Saucedo, she is the president and CEO of a TransLatin Coalition, and a national organization that focuses on addressing the issues of transgender Latinos in the United States. Bamby developed the Center for Violence Prevention and Transgender Wellness, a multi-purpose, multi-service space for trans people in Los Angeles. Through her leadership, she has birthed several organizations that created community where there was none and advocated for the rights, dignity, and humanity for those who have been without a voice. Bamby has been featured and recognized in multiple media outlets such as People in Espanol, Latina Magazine, Cosmopolitan, the LA Times, LA Magazine, Out 100, and featured on the HBO documentary, The Trans List. Bamby has also been recognized for outstanding work by multiple national and local organizations. Bamby, we are glad to welcome you.
Hello everyone, greetings and many blessings to all of you who are joining us today. Particularly gratitude to the organizers of this amazing forum. Thank you for the opportunity to share space with all of you, and I hope that all of you are also taking care of yourselves and your loved ones, and are taking the precautions needed in order for us to be able to combat this unfortunate pandemic that we're all experiencing. A mí me gusta empezar siempre dándole gracias a mi poder superior por darme la oportunidad de estar aquí con ustedes, y también pues dar gracias por un día más de vida y un día más de poder respirar. I know that it was probably hard for some of you to understand what I just said, but it is a customary thing that I do to thank my higher power for the opportunity to be with all of you here today, but also for having the opportunity to breathe one more day. As it was said, my name is Bamby Salcedo, and I am very privileged to lead a national advocacy organization that is based in Los Angeles, and that provides also life-saving supportive services to transgender nonconforming individuals in Los Angeles through the Center for Violence Prevention and Transgender Wellness. I was invited to participate to sort of like give an overview of the multiplicity of issues that trans Latinx individuals face in this country, but also as it relates to accessibility to HIV testing, and also obviously because today is National Transgender HIV Testing Day, to sort of like give an overview about not just the challenges, but also the strengths that we as a community, I guess, have, and you know, what are some of the things that we obviously, you know, do in order to live, thrive, and survive and succeed in our society. Because today is National Transgender HIV Testing Day, I do want to sort of like give a little bit of context and a little bit of history of how this particular day started. And I wouldn't do that if I don't obviously recognize the pioneer of this particular day. And I want to acknowledge and recognize my beautiful and dear colleague and sister, Joanne Kidley, who is not working with directly with the Center of Excellence for Transgender Health, but when Joanne Kidley was working at the Center of Excellence for Transgender Health, she was actually the person who started this initiative, and see the importance of trans people having the ability and the opportunity to be tested, and obviously to seek the resources that we need in order for us to continue to be healthy individuals. So thank you, Joanne Kidley, for pioneering this particular day and this initiative. And I also want to say that, as we know, trans people, as well, we have this great day that it was specifically designated to mobilize trans people to be able to have the opportunity to test. We know that, unfortunately, trans people continue to have challenges while trying to access HIV testing. I do want to obviously recognize that there are multiple places who over the years have increased their capacity and there's sensitivity in order to be able to provide HIV testing and HIV care to trans people. And we're very lucky that we have Dr. Molano, who is also one of our comrades and friends in the field, who have been able to design and develop different programs to support trans people. And so I think that's important for us to recognize. So those of you who are participating in this session and do have the ability and work at clinics or hospitals or medical centers, for people to understand the importance of being able to really provide not just HIV testing, but medical health services to all transgender nonconforming individuals. And so I definitely encourage people to do that. And obviously there are resources available for people if your clinics or hospital or medical settings are looking into really expanding the services that you provide, particularly to populations that continue to be marginalized, such as trans populations. We are, at our organization, we could definitely support and be able to provide and develop policies that could be implemented at your organizations. So please reach out if there's any way that we can support your efforts and your work. I also want to talk a little bit about, some of the issues that are currently happening in trans Latinx communities as it relates to um, the pandemic that we're all experiencing right now. As we know, unfortunately, well, I'm going to say everybody, right? Because this is a global pandemic, are experiencing a multiplicity of challenges. But I think it's also important to recognize the challenges that trans Latinx individuals are experiencing right now. And one of the things that I can definitely share with all of you is that the calls our center here in Los Angeles have increased up to 500% from people calling members of our community, really calling and expressing their fear of different things that are happening. Obviously, those who have had the ability and the opportunity to work in the service industry, like, as we know, many of the jobs that trans people, particularly trans Latinx individuals, have to resort to is performing at bars, for instance, or nightclubs. Also, um, in the beauty industry, if you will, or in the what do you call it? Like when you cut hair. Yeah, like, there's beauticians who obviously have those type of jobs, who unfortunately have to have been laid off, right? And obviously those are the ones who have the ability to have employment, right? Also, there are many trans Latinx individuals who are undocumented, many who are still in immigration proceedings, who have cases pending, who do not necessarily have the ability to work because they do not have work permits or any type of um, a social security number, or sometimes even identifications to even be able to identify themselves. And so there's a lot of fear in the community of people who even have a place to stay to lose their place to stay. So we anticipate that many members of our community are going to be homeless more than we are seeing here in Los Angeles. I think it's also important to mention that for the first time, the Los Angeles County, when they did their homeless count, they counted trans people here in Los Angeles, and they reported that there are about 1,000 trans people who are homeless in Los Angeles. This was obviously pre-COVID-19, and now with this pandemic, we anticipate that more trans people are going to be homeless. And obviously, because we live in California and because here in Los Angeles, the Latino population is more than 50%. We know that trans Latinx individuals are also the majority of trans people who live both not just in Los Angeles, but also in San Francisco, in comparison to other minorities or in other ethnicities. And so that's one of the things that we are seeing. And one of the things that I think is important for me to highlight is that trans people and the overall conversations that are happening with this pandemic are not being included, right? We know that some of the things that are happening interrelate to trans people, but unfortunately there's no specific resource allocation, for instance, for trans people in general, let alone for trans Latinx individuals. So this is something that we definitely need to consider as we continue to navigate and explore the possibilities of how we're going to support the populations that are most impacted. I think because of what we're experiencing with the pandemic, and especially, how there's been an increase in prejudice and stigma, obviously related to particular populations. We're also seeing that with trans people specifically, and accessibility to different services, particularly those individuals who are homeless and who are not, who don't have a place to go, if you will. Luckily, we as an organization, we continue to have our doors open, because we are considered to be essential workers, and because there are many members of our community who need the support. We are giving food and obviously, providing limited case management and figuring out ways for us to continue to support people who need this type of support. I do want to also mention that a specific issue that trans Latinx face, which is the immigration issue, and not just through the process, but also those individuals who are in immigration detention. Our organization recently released a video that was sent to me by a trans woman who is in immigration detention. And it's a campaign that we are launching, or we have been going on, to free Kelly. Kelly is a young trans woman who is the trans woman who has been in immigration detention the longest than any other trans woman. She's 23, and she's been in immigration detention for almost 3 years. And her continuous petitions for parole have been denied for no reason. Obviously ICE has a reason, but it is not a justified reason. And so we are obviously making sure that, Kelly, who has also been diagnosed with pre-diabetes, and is not receiving the appropriate diet that she needs, and also is being exposed to COVID-19. It's really discerning and heartbreaking that people who are in immigration detention don't have the ability to live, right? Because they're obviously secluded. And so I think it's important to recognize that individuals who work at these facilities, like correctional officers and medical personnel, or even administrative individuals who are exposed to the outside world but come inside, those are the individuals who really could potentially be the the transporters of the virus, in which puts individuals who are there at risk. So I guess just to close, I want to invite people to visit our website and take advantage of the different reports that we have. We have generated information for people to have access to, and it's free for the taking. So please, go to our website, TransLatinCoalition.org, and have access to information that could potentially be helpful to you. So I'm gonna stop for now, and then I think there's gonna be an opportunity for questions later on. So once again, I want to say thank you so much for the opportunity to be here with all of you, and I hope that you're doing well. Thank you. Ben?
Bamby, thank you so much. That was a very powerful message, and I think this is a great opportunity now to have Dr. Luis Freddy Molano join our conversation today. He is an advocate for quality healthcare for everyone throughout his career. He has worked as a family practitioner in South and Central America prior to joining Community Healthcare Network in 1989. Dr. Molano became Associate Executive Director for Women's Health and HIV Prevention Programs, where he started and implemented one of the most successful HIV programs that really integrated HIV counseling and testing with women's health. And as a result of his efforts, he was named Assistant Vice President of HIV Programs and Services, where he was there for 6 years before being named the Vice President of HIV Programs and Services in 2010. Dr. Molano, the floor is yours.
Good afternoon, everyone, and thank you for the invite. I also want to send a very special hug to Bamby. We lost one of our trans leaders in the community due to COVID, and I know how powerful and inspiring Bamby has been to the community throughout the country. But also, Ben, thank you very much for inviting us. I must mention another person that I had the pleasure to work with from the very beginning of the National Transgender HIV Testing Day, who is John Catley. At the time, she was running the Center of Excellence for Transgender Healthcare. And she was just a unique human being that we're still friends and an inspiration for all of us. And she believes in always giving, giving, and giving. So the national, can we go to the next slide? This is just what I work hard. The approach that we come from the Community Healthcare Network is trying to integrate everything that we do with the transgender community. When I was in the Bronx working 14 years ago, I found that a person had to go downtown in Manhattan to get her medical appointments because clinics were not offering transgender health. And I believe that transgender health is a universal right, and I should be able to get it in my own community. So my goal at the time was, having no knowledge of anything in the area, to see if we can promote the provision of healthcare integrated to primary care in every clinic. Our agency has 12 clinics now, and I wanted to make sure that as many people as possible will feel that serving a personal trans experience is serving us. So the National Transgender HIV for it will give us always an opportunity, and that's something that I took away from Joanne. They give us an opportunity to educate and promote testing, prevention, and treatment to help this community that has been devastated by ignorance, by abuse, and by just plain omission. I was reading this morning, I can go to the next one, please. I was reading some numbers this morning from the CDC, Bravely Different, and I was shocked that the numbers is still in 2019, and I'm not even going to go to the 29 to 2014, but in 2019, 14% of all transgender women have HIV. And by working in what we do, I'm suspecting that these numbers are undercounting, but it gives us an idea of what is going on. Then when we look at the breakdown by race and ethnicity, 44 Black African American, that's almost half of the transgender women of color who are living with HIV. And if we put the 44 and the 26 together, we got 70% of all transgender women are living with HIV. That's staggering. That's something that we need to think about it. Next, please. So basically, this is a little information about what I work, Community Healthcare Network. As I mentioned, we have 12 clinics now. We have 4 mobile units. And we've been doing testing. I always work with women. I come from a country when family planning was not allowed. So I made my business to work with women, and we were able to start the first program in the country to test women who were pregnant. And we did a study. I was part of the pilot, and then from testing women back in 1989 when people were not aware or did not count women as potential patients of HIV. We started the campaign, and last year we did over 30,000 tests. Mostly we do the rapid screening, and also we do the blood work, but for generation. But again, it's important that we think about the trans community as any, or as we think about of any other group that needs and looks for and deserves medical care. Next one, please. Now, engaging the people of trans experience, because that is always something that is very easy, and this is one of my fights with the policymakers. The many times we hear about the government or the whoever is allocating $100 million to do testing on men who have sex with men, or women of trans experience, whatever group they are targeting, but really not taking in consideration what the population, or looking for advice from that population. How many times do we went and reach the transgender individuals? What do they think about this program? Because I believe there is always a purpose. Not the numbers is very important because give us the funding, but it's also look at the impact that HIV is doing or could do in a community. And also at this point in 2020, I think that we had found a lot of tolerance from many healthcare providers, and we have to move from tolerance to acceptance. We are who we are, part of the community, and we need to keep that in mind. And even internally, we have around 80 providers. When I hear somebody saying something inappropriate, it's my obligation to correct that person, because it is from the moment that they enter the door until the moment that they leave. So acceptance versus tolerance is my campaign for this year, because we need to get that embedded in everyone. But also we have to understand what HIV means to the community and the individual, because the trans community has been exposed to every single negative aspect of life, and that's not right, and we got to stop it. This community has been marginalized, traumatized, and now we're going to be adding one more trauma, which is HIV. Yes, we have found many women that were doing what I call survival transactional sex, and they were not aware of their status. I remember one time last year, around 1:30 in the morning, in the mobile unit, in a 58-year-old woman came to me, the mobile. And she tested positive. So my question to her was, what are you doing now? In my mind, I was trying to establish a support network for her to see what are we going to do. On her mind, it was, I need to get 3 clients because I have to pay my rent tomorrow. So, so we had the conversation, and the teaching experience was, it's not what I have in mind, but it's what she is going through, and what she has in mind and what she has to get. So before we force or we try to impose the testing, we really have to listen to what they are telling us. Next, please. So in order to do a program that is successful, and you probably have seen this many times, but I always go back to the basics, is the safe environment, because that's any program should start with the community. Will this work for you? Will this, if we create the program, will that something that the community will be interested? Who can we work with? And start getting that cultural sensitivity, which is more like clinical sensitivity. Sometimes cultural and clinical, they don't go hand to hand, but they should. When I call expanded hours, is because when we were trying to establish the program from the trans community, clinics work from 9 to 5 most of areas. Our patients, they are night workers, and they have expanded, what I call expanded hours. So how can we make them easy for them? Plus, keeping in mind that the morning hours are not good, keeping in mind that they still have to survive, and keeping in mind that it's much easier for you and I to find a 9-to-5 job and pay the bills that for this community find food security and housing security. And finally, how can we do the testing in a routinizing way, doing safer sex education, and that could be a little intimidating or too academic, because what we're trying to do is really the harm reduction model. We want to make sure that it's to introduce some safer features so they be able to protect themselves. Next, please. So creating a safe space, again, creating a safe space will start with the community. Tell us what make you feel good, because when they come into our place, they want to see people who look the same, who are not being judged, who are not being looked down. And that's really, really when we start, the moment that that person enters the clinic, whether it's an ambulatory care facility or whether it's standing up clinic. We have to think about how my organization is welcoming our patients. And that's happened every day. Do we have a consistent treatment, good treatment for people of a trans experience? Or that's happened only when I'm around there? So also the branding, get involved the people with the names, the services there are, because you cannot do a testing program without having any provisions for primary care, without having support services, because sometimes the health is the last, or number 4 or 5 on their agenda. We have, again, housing security and food security. How are we going to manage to message them and to be in contact with them? We created a Facebook page when we offer to the client and said, if the case that we need to contact you with a normal lab result, can we send you a code encrypted message, something like, hey, Freddy, a party is happening on Thursday at 3 o'clock. Can you confirm your attendance? So that's telling Freddy that he has an STI or have something that he has to take care of, and call me because we would like to see you. That's how now I learned that from the trans community themselves, because many of them, they will not have a phone, but most of them have a Facebook page that they can sign anywhere. Case management, and I think in that because ideally we want to have members of the trans community to provide the case management, in the sense that they are the most supportive, they know the resources, they know everything that is happening in the community, and that's another benefit of including people with trans experience and the staff. And the community partners, I call them gatekeepers, because they know who's moving in, who's moving out. And I mean, like our departed Lorena Borjas, she, if I needed something, she will get clients in the YMCA shelter if she needed. One day I had the conversation with her on why she didn't move from her apartment, which was a studio. And she said, Freddie, I've been there 38 years, but I know I don't want to move because my patients know where they can go if they don't have a place to sleep. That's the community partner. And I think that sometimes we just look for big names or other community or medical associations. What the best partners that you have for these programs are people of trans experience. Next, please. So the cultural sensitivity, and again, I struggle with cultural and clinical sensitivity because, and this has to be an ongoing, HIV testing. We offer the HIV testing to everyone in the clinic, 13 years and up, who's sexually active. I disagree at the time with the CDC in the sense that we have 64? No. We need to test everyone who's sexually active. And from providers to the front desk, when I go to it, because again, stigmatization goes all the way. I may be very welcoming or feel welcome by the front desk and by the doctor. Then I go to the lab, and the person who's going to do my blood from the test is going to say, or make the face. That's a lack of sensitivity, and that's something that we need to be able to correct and apologize for when it happens. Hiring and consulting with people with trans experience, cannot say enough of that, because it's the only way. And if we want to have a successful program, we need to have the trans community. My department, which had around 44 people, have 9 of trans experience, and not just in the front line. They have to be managers. They have to be. At one point, I was able to have one of the health providers who was a nurse practitioner, a trans man. I also have a mental health. So we really need to think about how can we utilize their knowledge and share their expertise, because that will also serve the community. Next. The expanded hours, so we talk about this in the night clinic. My CHM, what I call the night clinic, again, my Lorena, we were working, and she will say sometimes we try 9 to 5. Obviously, that didn't work. That was the first lesson. Then Lorena said, why don't we go from 1 to 9, 1 to 8? Okay, let's go 1 to 8. I got the staff to do it. And they were my staff was pretty good. It was a success, but nothing really was coming. And then one night, as we were leaving at night, somebody said, why do you guys stay? Don't you know that the girls are working around midnight? So we start trying 6 in the afternoon to 2 in the morning. And the idea was just do the testing, but I said, okay, if we do testing, people are going to know that we are the testing van, and because they are the trans individuals, they are going to be looked down. So I said, let's do a full medical services, which we did. And then we needed to continue to expand. And sometimes we have from 20 to 30 people. One time we have 45 people coming. And that's important because that's the time that the transgender individuals are working on. That's the time and the field. So what is very interesting that after a while, the trans patients start putting up tables to do the outreach themselves. Never asked them. They just one brought the table, then they brought, then I got the condoms, and then they start something else. And they were bringing, if it was the summer, they were bringing this wonderful fruit juice. And if it was the winter, they would make all type of coladas that I never knew what they were, but they brought it themselves because that was like, it became a real gathering place to identify new clients, to have new patients treated for HIV, to test more individuals without being stigmatized, and the introduction to PrEP. So once that they were introduced to PrEP, we have probably over 40-something women and trans men that are taking PrEP and have been going to the mall on a regular basis. So Lorena help us. We have another protege from Lorena, which is Leanne. And I have seen her growing from a very shy woman to an advocate of international caliber now, thanks again to Bambi for her help. But again, let's think about the transgender individuals' hours, not just what is convenient for us. Next, please. So again, this is very simple, routine housing, HIV testing, safer sex education, a harm reduction model. And this is a little about what we do, because things have not changed. I believe in integration. Whether we're doing family planning, whether we're doing HIV testing, or we're doing trans care, it should be integrated. And I think that the HRSA should make it mandatory for every funded agency who's providing primary care to include a specific treatment for people with trans experience. And they are able to, when they come, we offer the test to everyone 13 and above. In New York, we realized the opt-out model. A friend of mine calls it the 4 vital sign, and that's important. And that's the way I start seeing it, as testing as the 4 vital sign. And then we also know that if you are positive, you can start IR-based right away. That will make you undetectable, and detectable make you untransmittable. And that's another way to promote the testing. Let's focus on the benefits in the long term that the person can have by testing and knowing her or his status early on, and that being undetectable, it keeps you healthy. Next, please. So this is some concepts about the routine nursing with the transgender patient. Again, it's part of the whole medical care. It's part of the patient flow. We try not to put it in a different day. They come in the same day that we have prenatal care, that we have primary care, that we have diabetes, because it's integration. And we have to really do a better job of integrating everyone. We don't have a day for the African Americans. We don't have a day for the MSM, because again, it's integration. And we all have families. And ideally, you take your family to the doctor when they get sick. So that's the concept that we want to project. When somebody is diagnosed, we do IRT, which is immediate therapy, the vital load suppression. And we also, when we are talking about the financial value, because for people who are in the survival sex business, if you get sick, you go out. You got to be out, and you got to pay your rent. So many ways that we can play with the words, but keep the person in mind. And the stigma, it is there. So again, integration, integration, integration. Next. So some of the challenges with stigma will be present. It's something that you are not going to do away in one day. You need to, the staff moves, and you get new staff, and you got, there is always the people who are going to look at, oh, they are there again. So stigma will be there. There was a good article in Pulse magazine that I just got today, and it's called Challenging HIV Stigma, about the importance of peer support, training, increasing the consent technology. I want to say that we are starting something new that I want to share with people in the call, because other sure technologies is given us, and I will be able to hook people with them, to the home testing devices, which normally in the pharmacy costs about $40. So these are out of COVID. They don't want to come to the clinic, and they need the testing for PrEP. So we can do over the phone a form, and they get the testing device delivered to their houses in 3 days, 2 to 3 days. So I said, why not to use this for our transgender patients? Even to them, they can do it in their homes, and it's very easy. So I'm trying to put that together, and I will be more than glad to share resources in once that we have that in place. And again, accommodating needs of transgender and support services. Support services need to be part of them. Next, please. So basically, that's also, again, I want to be very mindful of the time, and but also I'm very grateful of this opportunity. Many people had for the before. Right now, with the COVID, we had lost 5 girls, 5 ladies, and 2 staffers in the last 10 days, which is still very painful for all of us. We organized and trying a food drive, because again, the city will open those places where you can go and grab your food and go. how many of our patients can be there at 7:30 or 1:30 and being in a line, keeping the distance, being exposed to the nasty looks. So we're trying to organize very informally but effectively food drives when every week we are bringing food to around 30 people. And sometimes we try to include a metro car because they need to go some places. And what New York is living with 13,000 deaths and COVID-related deaths is horrendous. And I wonder, we know of 5 individuals who trans experience from our program. How many more? We don't know. So I want to let you everyone with the challenge. This is just starting testing, HIV testing, and hopefully soon COVID testing will be part of the new DNA. We will never have a reality in the way that we had it before because obviously it was not working. But let's make sure that when we talk about implementing programs for the transgender community, we call them to the table, we made them part of the table, we made them part of the planning process. Thank you.
Thank you for that, Dr. Molano. So now we'll take questions from the audience. So please either use the chat box or raise your hand. But we do have one question here. So what can we do at the local level to help ensure we are capturing the Latinx transgender community as it relates to COVID-19?
I mean, I think it's important that we recognize that every locality is different, right? And obviously that depends on the specific needs. But I would actually, figure out ways to reach out to the local Trans-Latinx community to find out specifically what they would need. And obviously, through the organization, find ways to support those individuals. But also recognizing that, in the trans community, there's always sort of like this hesitancy to reach out to people. So I think because of the circumstances that we're all experiencing, it's particularly important that we go the extra mile to reach out to those individuals who may be completely isolated from all of the communities. So I would definitely encourage that.
I also think that is the most important, it's very important to make sure to identify a person who has experience, who is able and willing, and get the money to pay them. Not just as a peer, but get some funding to start, because they will, the community will trust their leaders. They know who can trust. So we need to start with them as well.
Great, thank you. Does anyone have any questions from the audience? I do have one question here. Besides LA and the Bronx, what cities are your focus for the program? What cities do you think we should focus on to affect the Latinx transgender community?
I mean, I think, I want to echo what Dr. Molano said, that, healthcare is, a human right, right? So it should be available for everyone. One thing that I will say though is that, again, I mentioned in my presentation that, the Latinx community overall in the country is rapidly growing. And so with that, it's important to also recognize that trans Latinx are also growing in population. And so, depending on where you are, I think we're everywhere. Obviously, like I said, right? Like if we think of New York, San Francisco, and Los Angeles are sort of like considered the meccas for trans people. That's for the most part where trans people really migrate to. But the truth is, like, there's people in North and South Carolina, and also trans Latinx individuals, right? There are trans Latinx individuals in the South, in the Midwest, and like we're everywhere. I think the question is, how are we going to ensure that we're not only reach these populations, but also that we are equipped to support and provide the services that these individuals needs.
Yesterday we had a memorial for our Lorena Borjas, and I was so surprised that we have like 6 participants from Texas. So I think that we need to recognize that many of our trans Latinx are also coming from Central America, and they will relocate to the state that they can make it to, really. And fortunately, in New York, we are able to have some less strict rules to provide services. We provide services for them. But I think that if we look carefully, I believe that every major city has a trans Latin community that needs help and needs services.
Great. And one last question, and just want to wrap it up, but want to be respectful to everyone's time. With COVID happening and affecting everyone, one of the things that comes up is mental health and depression. Do you think in the trans Latinx community, do you have any resources available or any speakers or thought leaders who would be able to kind of talk about to transgender on that?
Yeah, I mean, I think mental health, obviously, COVID-19 really shifted many of the things that we were all doing, right? And definitely mental health is one of the things that has increased in the overall population because of the isolation that we're all experiencing. For trans Latinx individuals, it's not much different. I think for us and we as an organization, we're definitely finding ways to continue to support our community in that way, creating platforms that will support people to navigate, those issues that they're experiencing. And for us, obviously, we're training more and more people in the community to be able to do peer counseling, right? Because again, unfortunately, many people in the mental health field also, there's a couple of different things that happen. One, there's not many people who are monolingual Spanish speakers, for instance, for those who may need it. But also there are many people in the mental health field who are not necessarily equipped to really support trans Latinx individuals. So we are increasing capacity in both ways, not just in our community, but also service providers for them to be able to also support us through those efforts. So that's definitely something that, is impacting our community drastically, but we're making sure that we figured out ways for us to continue to work together to ensure the well-being of our community.
Yeah, I think that finally, I think it's important that keep in mind that for us and Latinos, we always had this stigmatization about mental health and many other communities. So we have to be more careful and more sensitive because we associated, back in Colombia, where I'm from, we associated mental health with being crazy. So we need to make sure how we introduce those topics to our communities and to make us as part of dealing with day-to-day questions rather than to see it as another disease that we have to deal with. Thanks.
Awesome. Well, thank you so much, Dr. Molano and Bamby, for joining us today, and thank you to our audience for joining us today. The webinar recording will be available on our webpage on everything. Again, thank you and stay safe out there.
Thank you so much for the opportunity.
Thank you, everyone. Love you, Bambi.